What a lot of Yanks don't know, Cassandra, is that your prime minister, facing austerity issues because of the economy there in the United Kingdom, is proposing very significant cuts to your national health system.
Well, yes, Gary. But let me first point out that this was something that in the run-up to the general election last year, both Labour and Conservatives were talking about. So the fact that there are changes in the national health system, service system, are not to be sort of, they're not no big surprise. And it's a restructuring of the National Health Service. Essentially what's happening is the bulk of the funding from the large National Health Service trusts that are based around the various hospitals is being taken away, and it's being given to put into the hands of the general practitioners, the GPs who see people on a daily basis. And this move will allow GPs to determine what the treatment is for their patients and where they will receive that treatment. This means that they'll choose the medical facilities, whether they're National Health Service or whether they're private. And the government feel that this will lead to an improved patient care and a reduction in the costs, because one of the huge criticisms of the National Health Service Trust is that they have grown, the cost of them has grown tremendously, and that isn't because of the facilities they're providing. In fact, a lot of the National Health Service Trusts have been overspending and are deemed on examination to be inefficient. But it's because of the huge bureaucratic burden that they place. The administration in these National Health Service Trusts has risen far beyond what the number of doctors and nurses who operate within the National Health Service. So it's feeling it's cutting down on the bureaucracy. They feel that the National Health Service will help towards the inevitable cutting back on the National Health Service in this way, will actually allow for the inevitable rise in demand in the coming years, because it will free up more money. They accept that the costs are in actual fact going to rise. The opposition feel that these measures will destroy the National Health Service, that's the Labour, and put people's lives at risk. The ability of the GPs to choose any facility is what is most contentious, and this is that they anticipate that large commercial companies providing healthcare could undercut the National Health Service provision and starve them out of existence. So that is the big fear. They also argue that it will cost money to put this into operation, and in actual fact it will cost. They anticipate it will cost about 1.4 billion to reform the health service, but the anticipated cost savings per annum they anticipate will be around about 1.7 billion when this is completely operational. So we have this huge debate going on. There are lots of people speaking on this from both sides, and you'll find, the British Medical Association issued a statement today that said that they felt that it would not be at the it wouldn't be to the benefit of the patients, that these decisions needed more discussion and more debate with healthcare professionals before anything is put into operation. But we do have some pilot schemes that are running throughout the country that are operating this system, and it is working extremely well. So it's felt that the bill will go through, that this reform will happen, but how successful it's going to be will very much depend upon the way in which the GPs operate it and how effective they are in operating it. Gary.
Well, it sounds to me like your situation there is as confusing as is the debate here in the United States. And the debate here surrounds, in some large measure, cost. Because as the Republican Party prepares right now to shepherd through the House of Representatives a vote that would repeal the health care reform measure that was the highlight of the last Congress, which was then controlled by the Democrats and was pushed very strongly by the President of the United States, so that detractors with disdain and supporters with admiration labeled it Obamacare. The bill to repeal what we affectionately or disdainfully call Obamacare refers to how it is stealing jobs. And there's a huge crescendo of argumentation in the United States over whether that is a fair representation of the legislation that was just passed.